So this is actually a project in the making. I do have the text. I'm still considering how to present it because, as you see, it is a theater play. Why a theater play? I became completely by chance a teacher. In fact, I understood that I'm a teacher and not a healthcare professional very recently. So now I understand that I do have this probably small possibility of changing somebody else's perception of whatever they do through my efforts. And what I notice in my university, in our university with Ivanka, Dr. Vasileva, our colleague, we do work with people from different age groups, but we do work with them on very important disciplines that are highly regulated, and that is healthcare. And sometimes I know that we expect from them to be highly trained, very, very competent, to treat really serious healthcare challenges. But then we forget that for each and every one of us, health is something different. What motivates us is something different. What is important to us is something different. We're unique. We're really, really unique. And we forget that giving this opportunity for a physician, a midwife, a nurse to experience this uniqueness would make them actually a better professional. It won't make them softies, no, they'll make them feel the patient and provide the most important care, the care that the patient needs at that moment. How all this started? I'm a political scientist by training, so nothing to do with theater or healthcare. But this, can you see this? But this is me here in 1996. And this is my fantastic friend who is a theater director. This is us 30 years later during our mid-project meeting when we were discussing our play. Because I use her power of knowledge of theater, of emotions, of allegories. But you see, of how to make our students experience in a safe environment. What are the challenges every patient faces, or every physician faces when it comes in encounter with very tough, always conflicting cases. How do you have a solution to something that has no solution? There is no right and wrong. Because as I was saying, it's so blurred. Healthcare is so impossible to tackle that you have to make sure that you have this probably guiding principles of how you know that you're doing at least some right, some good, not just wrong. Also, what I saw is that sometimes when it comes to principles, they're fantastic on paper. They're so clear-cut. You understand, you can apply them, but the real life is not like our blocks of Legos. It's very tough. They're not, straight lines. They might be rounded, unpleasant to impossible to fit in the right places. So having this multi-perspective experience of uniqueness of different roles, of different expectations, in my opinion, would help also our colleagues, our health professionals, to take off the burden of their shoulders. They have to be these gods that always give the correct answer. Very much against the Greek tragedies, where you have, at the end, the solution, you find a solution. So we thought that in this way we would help them also have the verbal opportunities to experience what are the moral conflicts. So what are these? We have, normally in Europe, we work on the theory of principalism, the so-called Georgetown mantra, and these are the 4 principles. Here you have beneficence, so do good. The second one is autonomy. We are autonomous, free individuals with free decision-making power and agency, and we can choose what is right for us. Then you have the non-maleficence, do no harm, and the justice. These are the 4 principles of medical ethics. And of course, in the play, these are the main characters. So you have, well, please excuse me, it's in Bulgarian, so these are the Bulgarian names, but it's in theater, apparently this is called non-maleficence, logins. So it means the name actually represents the character. So here you have Dr. Benevolensky because he wants to do he wants to do good. Here he has Dr. Autonoma. Later on I'll explain how Bulgarian names are created, but this is Dr. Autonomova, who is, the person of autonomy. Then we have Professor Preventovsky. He's about do no harm. Always do no harm. That should be the first principle of medical ethics. And the last one is Dr. Filantropova, but her first name is Justitia. So, how to do wrong. And then I have several other characters that are the circumstances, the context, the fatigue, the unknown, and so on and so forth. We have scenes, because apparently you cannot have chapters, so my mistake here. But in theater play, you cannot have chapters, you have scenes. So every scene has, you have the actors, the roles, but you do have a case that evolves. And you do have the actors, the conflicting principles of medical ethics, discussing the case. And it enriches the theory, because you can always see the different perspective. How difficult it is to find a solution to this conflictual, because there's, again, there's nothing wrong or right. They're just different perspectives, equally important. It is a safe space, because normally in the auditorium, sometimes students are bored, sometimes they want to perform, and so on and so forth. But once you do this role playing, I think you also take some of the worries a student might have to perform or be outspoken about what they think. Again, we used a lot of artistic methods. Thanks to my colleagues. Actually, my friend, she's not a colleague, my friend, she actually works with educational theater for young kids. And a lot of the approaches are implemented here because, theater, a part of big aesthetic art that gives you pleasure of observing, but it also educates your moral values, your understanding, your compassion. And here my conclusion is, I took it, it's attributed to Aristoteles, but it's nowhere to be found, but you can see it's based on Nicomachean ethics. It says that we do educate the mind, but if you don't educate the heart, we don't educate anything. And then I just read the news earlier today about a Chinese scientist who is reproducing humans. And he actually said that ethics is what hinders progress. And I believe that with this play, I want to make sure that students understand that in a world where we can do whatever and whatever we want, it's very important to know what we can do and what we shouldn't be doing. And then I've translated something for you. It's not a perfect translation, but if you don't mind me indulging me for the next 10 minutes, and then we can discuss. It is part of the play with some of the roles, and normally we tend to feel for some characters. You see the characters, please choose the character that least appeals to you. Because one of the important objectives here is to fill somebody else's shoes, to be somewhere else, someone else. Sorry about that. And also I have the case here. And I would ask you to read the role, to feel it, to understand the character. And I would also ask you afterwards with the group you're in to discuss the case, representing the position of the character. And then when we finish, you could either present or demonstrate the play as it is, or just comment on it. It's completely up to you. So this, ladies, would you please join in?
Yeah, sure.
Here you go. And this is the case. So please, the three of you. Would you play?
Yeah.
Would you mind, ladies, playing together? We're playing together, how it's a...
Play together.
Here you go.
But we choose the less
The one that...
character.
Yes,
It's less like us.
exactly.
Yes.
Yes, because I don't want you to choose just this.
So
Yeah, because...
Less than, do I have to pretend or do I have to
Yes,
answer?
yeah. Try to understand the other perspective.
Maria, you want to join us now?
Here you go. So it's quarter to. If you want, how many minutes will be okay? Probably about 10.
Depends on how the case is.
Yeah.
The case is it's dialogue, so it's one page. It's one page, but if you can see the characters here. And what would you do in this case? It's really up to you to share the experience in the group. If you want, you can also see. You see, ta-da-da-da, ta-da-da. You see, theater allows you to be under the projector light and be somebody else. And
Do the same with your students.
I have not done it. You my guinea pigs. Guinea pigs. I have not done it yet. I hope to introduce it for the next semester.
We're developing it. Right.
I'm developing it. The text is there. The ethical discussion after each chapter, after each scene is there. I still have not published it. I want to polish it. I want to make it perfect. Impossible, but it's ready. I do hope to have it printed by next semester.
So we do it but without audition first time?
Without addition, just imagine you in the amphitheater and how do you feel about it?
Strange, but
Strange.
interesting.
Yeah.
We're interested. We actually decided who is who. So
And it was very easy for us
Pardon?
because everybody choose one
Yeah.
said we didn't like this one.
and it was different from the beginning. We didn't say the same.
That's yeah. That's
That's
quite-
more text, like each of us, so that we can,
yeah. Sorry, I just.
we can just stay.
Yeah, sorry about that. I did print, but I've forgotten everything in Sofia. I took the Bulgarian version, so I had to print now. I don't want to bother the university. Exactly, but what you want to do is also, because this is setting the scene. This part of the text is just setting the scene, because we know what is happening. We don't know what is going to happen, and it's really up to us to decide how to go. Because this sets the scene. You have to find a solution, or probably you can discuss what could be the solution. Because justice, justitia will...
They continue.
Because here is...
What happened next?
What happens next? Because Dr. Contextua enters and says, that's it. She doesn't want to be examined by a male physician. But you have a lady who is expecting a baby. And this condition is high risk, both to the baby and the mother.
The question is how fast the female physician be organized. That doesn't say here.
Yeah.
Case in real medicine.
Yeah. Yes, yes. I also have, because I come from medical family for generations, so everybody around me is are physicians. So I ask them to actually check on the factual conditions and diseases and how urgent a certain condition is and not. So it is a real case. And this is potentially very dangerous situation. Very dangerous. But then you see there is something else. Oh, I want to make sure that students know that they always work with uncertainty. Always with uncertainty, because apparently here you have the information. You have the symptoms, the condition, what the algorithms of treatment say, and so on. Then you also have her social condition, because it's, you know, the way she's dressed, or what she says. But then later on in the text, because this text develops in a different scene, we see that the information we've had is completely imperfect. It is actually something else.
You don't know really.
But you don't know it. At this time, you cannot know it. And still you have to make a decision. How brave one should be to make a decision based on imperfect information. How difficult it is to know that your decision will impact either the physical or the emotional or the social well-being of a person. We have 5 minutes, 4 minutes. Do you want to go? Please. And you see, use this.
Light.
The light.
The light's off.
Look the light. Use the light. And don't forget, I mean, these are the very important factors. The time pressure, how tired you are, how your resources are, if they're limited or not. Come on, come in. Only if you feel okay.
Yeah, we do.
Okay.
Just borrow one of the texts. Text, no, not that one. And then
No.
it was borrow it.
Probably also you can share how you felt about the principle you're going to defend.
Women, I'm the only man in this way, and they're already there loitering.
Oh, you see?
Can I take video?
Sorry?
Can I take video?
We're being filmed all the time anyway.
Are we supposed to have him?
Do you want us
I guess so, this is the stage, right? That's how I understood it. Like, well, good. I was the food I was, hearing y'all for my own presentation. Okay, so, you are storming in.
Yeah, let's go on.
Okay, I'm doing what? I'm sitting. Yeah.
Dear colleagues, we have a case. Amira, 24 years old, I can't see my mobile phone, complaining of abdominal pain and vaginal bleeding.
Well, she must be examined immediately. Tell her to undress from the waist down and lie on the couch.
The woman is from Moroccan origin.
No respect.
Fine, we don't discriminate. If she's in discomfort, we'll examine her and decide what to do.
I don't think you understood me. She's wearing a burqa.
A burqa as in... Is that a problem?
If she wears a burqa, she's likely Muslim.
So what? She has pain and she's bleeding. She didn't come to the hospital just because of her period.
Dr. Beneficence,
It's me.
It's not a period. She's 26 weeks pregnant.
Well, call Dr. Rodensky immediately. He's a gynecologist. Bleeding at 6 months could indicate placental abruption. Duh.
Dr. Beneficence, the woman is a Muslim.
Dr. Autonomova. No offense, but what does that matter? She came here for help, didn't she?
Given her religious beliefs, she might not want to be examined by a man.
What? Seriously? She could lose the baby if she doesn't get help.
Or lose her honor and dignity, maybe. She's a married woman, probably religious.
Okay, so what do you suggest then? Pray to Allah and hope for the best?
I suggest we ask her if she's okay with being examined by a male specialist.
But that's wasting time.
She's conscious, Dr. Benevolsky, and it's not an emergency, yet. She has the right to choose who examines her.
The woman refuses to be examined by a man. We should continue it, yeah?
You should continue because
Because I've left.
because exactly you stormed out. This is
I don't remember my character, but I would say that we should examine her.
but you see your justice. And you say, okay, we need to examine it because we do owe our profession and our competence also to the unborn baby. On the other hand, you say, well, okay, we're in a limited resource environment. We have a female gynecologist, but she's operating in the other room. Do we pull her out of the operation to go there? Why? You said that she has to be examined. You said that Amira has to be examined. But you see, it's not justice if you actually deprive another patient of their autonomous choice. It's, do you mind 2 minutki?
Should the doctor should grow and learn
Yeah.
how
How to do.
react in such a case.
Exactly, but you see what is also the moral conflict of Dr. Benevolensky, who stormed out? He's an emergency physician. His raison d'etre is to save life, now. I mean, and this is the trauma. I have studied, to save the life. The person is here within my hospital environment, I can save her and her baby, and she says no. And of course you get, and of course you have the conflict with Dr. Autonomous, the female. I mean, can you just focus on the medical story and just solve it? I mean, what about, forget about the religious beliefs or whatever. It's a human body with human symptoms, with human needs, and we can solve them.
I have a question. Are these all male doctors?
No, you can see it in the characters.
The only man.
The only man is, he's sanguineous.
Dr. Benevolsky.
And
Now or never.
is there something that it is taught for that?
Oh, what is it?
What is the answer?
In this
Is there an
case,
answer?
No.
there isn't an imperfect answer, because here you understand that there is never the perfect answer. Absolutely never. Because this is what we're trying to teach our students. Then in medicine, in our business, 2 + 2 is never 4. You can never ever find the perfect solution. You can find the lesser evil. And the lesser evil for us, it's the best. However, what we want to make sure that we know is that there are principles that could guide us in our decision making, that could give us the ability to verbalize what is going on and why we take that decision. Do you want to go, or we don't have the time? If you don't mind.
No.
Okay. We can continue later. Yeah, go.
Thank you.